Hello, hello, hello. I hope you come back, please. It might be new. Don't be angry. I don't know what's going on with either network or the tech world or the universe, but this video is not working and it's giving us a headache. So hopefully it works or is working. Um, so welcome back, Dr. Kudus. Welcome back. Don't know what's going on. Hopefully this works now, because yeah, let's get the show going. Anywho, let's see if you can. Yeah, I can't send you. I don't know what's happening, because when I click to want to send you a message or to invite you, it's blank, so I can't send you a request. Um, so if you can send me a request, please go ahead. Hi, come on in, come on in. We've been trying to make this video work for the last 10, 13 minutes, but it's giving us a headache. So, hi, 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 hi. Kenkenemenke kunumere. What's going on? What's popping? We've been trying to figure this thing out. Hi, hi, mama. Thank you. I don't know what's wrong with this video. It's just giving us a headache today. We've been trying to. Hey, the baddest blazer chick. What's going on? Um, yeah, my doctor is here, but my doctor, meaning my in-house doctor, is here, and we've been trying to get that video to work, because I don't know if it's a punishment because I'm not done live in the forever. So you understand? I don't know what we do. He's asking me what do we do. I don't know. Just join again. I don't know. Join again, doctor. I don't know what to do. I don't know what to say. This is yeah, I'm live. He said I'm actually live. If you can join again, because I'm sure he's frustrated. Live again. How are you guys doing, by the way? You know, this talk is dear to my heart. Come on in. Thank you. Hopefully you can sort this out as soon as possible. I don't know why this is not working for us today. But yeah, come on in. Thank you, thank you, thank you for joining. Thank you for joining. Let's see if our daughter comes back on, because this is probably, yeah, I know. Are you rested? Are you well rested? Well, come on in, and thank you for grabbing a seat and joining. I'll read that one. Mrs. Wonji says, how are you doing too? You look beautiful. Thank you. I've been resting a lot, and drinking lots of agua. And minding my business. That part. Anywho, where is my doctor? Please do this one. Even if you can hear, you can. I can't fight this thing again. I sent you an invitation. Please, edakun, edakun. I'm begging you. Hey, how are you doing? I
Hello,
see.
finally. Oh, right now I can't see you, though I can hear your voice.
I cannot see you too, but I guess we'll just make do with that at this point. I can't see you,
Okay,
but I can hear you. Um,
that's how it
guys,
comes.
in
Yeah.
the comments, can you hear or see him, or both? Please comment, thumbs up, or we can see him. I think we have to go ahead with the show, because you can see
Oh,
us
they can
both.
see both of
They can.
us. Well,
I
they are
guess
the one that
we'll
need
just.
to do
Oh,
from also.
Monica,
Yeah.
carry on. Oh, so let's get the ball rolling.
Yeah.
Okay, thank you, house. My husband is on live, so thanks, boo. Anywho, I'm gonna introduce him a little bit. If you guys don't know him, I'm sure most of you know him. This is our in-house doctor, Dr. Lawal Kudus. He's our OBGYN with an interest in oncology. He's the convener of CANCAD, Concord, Nigeria, a youth-based cancer advocacy organization, and also serves as the Director of Programs and Cervical Cancer Nigeria Initiative. He's an alumni of the International Agency for Cancer Research, IARC Summer School. He obtained WHO and IARC certificates on improving quality of cancer screening and HPV vaccination. He also had a UICC certification on advocacy for cervical cancer elimination, as well as International Gynecologic Cancer Society, IGCS, certificate on pre-invasive cervical disease program. He is a researcher and has made publications in the cervical space, including a recently published review of cervical cancer burden in Nigeria. He is, and I confirm, he's enthusiastic to share his knowledge on cervical cancer and inspire all to take action to elimination. I can't see you. I don't know if you're smiling or you're telling me I did not say it well, but I hope I said it well.
Yeah.
And
Thank
obviously,
you.
why I love having you on my show, because I'm a woman, right? And well-being is important. Health is important to me. I like to know what's causing my headache. I like to know, whatever my body is going through. And having you in my corner just makes me even more aware. And I always love and enjoy bringing awareness to people because honestly, a lot of people, when I say people, people in general, and now streamlined to my gender, don't even know the basics of caring for themselves. So
Absolutely.
I'm going to hand over the baton to you, and please educate us. Please throw in your questions if you need to and all of that. I cannot see, so I'm just leading like blindly, but go ahead, sir.
Yeah, thank you very much for having me, Chika. And sometimes technology, despite the advancement in technology, it will just fail you some of those these days. And
Right.
I think this is one event where that is happening. Can you hear me, please?
Yes, loud and clear.
Okay, because that's the most important one, at least. You should hear me. All
Yeah.
right. We'll make the best of what we have, and the most important thing is for our listener and viewers to get the message for them to take action. And I'm
Right.
sure that by the end of our conversation, we'll have been able to motivate them to take action about their health.
Correct.
Thank you for using me, and I'm always happy to be on this chat with you because what you're doing is something you may not really understand the impact it's having in the society. Messages and knowledge picked from this conversation will go a long way in improving the life outcome of people,
Right.
of listeners, not just people listening, but the ripple effects cannot be estimated. So it's a great one you're doing, and I'm happy that I'm back on this platform.
To have me back.
The topic of discourse today is setting agenda for women's personal health.
Right.
This is very important in the sense that this is a new year starting. Almost all of us set out to have New Year resolutions. We set out our agenda for the year.
Right.
By the end of this day, I want to be this, I want to be that, I must have achieved this, I must have achieved that. In all of this, we often forget the body, the person who we are, the system that is working in us that made us our being. We look at for, oh, I want to be, Chika Chin Chin should be, get to this point, we set a lot of target, but we don't set the target for our body.
Correct.
And conversation is telling us that we should set target for our bodies too. We should get to understand our bodies better. We should get to improve our
Right.
body in terms of health. Now, when you have a car, you you service your car.
Yeah.
You don't service your car because it's faulty. You service it to prevent it from being faulty.
Right.
So you plan that, oh, every 3 months, every 2 months, I'm going to do service to my car.
Yeah.
But for your body, you do nothing. You just live life and continue living. This tells on the body. So we need to have a dedicated attempt to improve our health outcome. We need to have a plan for our health all through the year.
Right.
that, okay, in the course of this year, this is my target about my health. Life is all about being healthy. When you're
Yeah.
alive and you're not healthy, then it's not worth it being alive, so to say. So you must keep your health supreme in all of what you do.
Mm-hmm.
So are we, looking at, it's not a particular thing, though, like you rightly mentioned in the introduction, I'm more into oncology. But I think my conversation today will be, let's look at different aspects of a woman's health which
Yep.
needs to be given special
Mm-hmm.
attention. As human, both male and female, we have similar body organs and system, but there are peculiar organs and system in the female which are not present in male because God has specially designed the female to serve a particular purpose which a man does not serve. And
Right.
this peculiarity, this special modeling and design of women comes with it a special requirement in terms of the woman,
Mm-hmm.
and that's what we are going to be focusing on.
Right.
There are things that cut across everyone, both gender, male and female, exercise, lifestyle modification, and all of that, in which we all
Mm-hmm.
need to do. But there are things that are peculiar to the women folks, which we need to pay special attention to.
Right.
Yeah. First of all, I'll talk about your menstrual health. Um, the female folks menstruate,
Right.
and menses is a natural phenomenon. It's a reflection. When you menstruate regularly, it's a reflection that certain system in your body is working the way it should.
Mm-hmm.
You must keep a record of your menstrual cycle. At the minimum, you should have a record of 6 months of your menstrual cycle. If I can keep it eternally, fine, that's good. But the least you should know is 6 months of your menstrual cycle. So you don't go to meet a doctor and the doctor asks you when was your last menses, and you say I don't know.
Mm-hmm.
It's so that you're not giving priority
Right.
to your health.
Right.
Knowing your menstrual cycle should be a priority for a lady, for a woman. You must know your menstrual cycle at the tip of your finger.
Mm-hmm.
And when we talk about menstrual cycle, the things you need to know at the fingertips about your menses, one, you must know the age at which you start menstruating, at which you started menstruating.
Mm.
It should be just know your date of birth. You should know the date. Maybe not the exact date, but at least you should know the month or the year
Yeah.
when you started menstruating. That should be at the fingertip. You should know how many days on the average your menses last.
Mm-hmm.
I mean, is it 5 days? You start menstruating today. How long does it last? Does it last 5 days? Does it last 6 days? You should know
Yep.
it. And when you're counting your menses, you count for the first day the menses appear to the last day when it stops flowing. So you must know that at the fingertip. You
Mm.
should also know the average number of days between these menses and the next menses. I mean, if today is day one of your menses, you should know the distance, the number of days between this day and the next one,
Mm-hmm.
and should keep a record of.
Mm.
The importance of this is this. When problems start, when you have issues with your menses, what we normally do in the hospital is to compare the present state of your menses to what it used to be. Because you have a normal pattern. No two women have the same pattern
Right.
of menses. A,
Right.
a twin set of ladies will have different menstrual patterns. So you should know your normal pattern of menses and you should keep record of it.
Right.
The number of parts you need you use on the average should be known by you, and this will form a baseline when there are issues for the doctor to understand what is happening as regard your menses. So you
Mm-hmm.
should know your menses. That's one thing you should know. So if you have not been keeping record of your menstrual cycle, start from this next cycle. You're
Right.
going to keep a proper record of it. There are apps online that helps you to keep a record of your menses. But if you don't
Mm-hmm.
use app, you can keep a record of it. Write it down somewhere in your diary. That's what our mothers used to do in the past. Write it down in your diary. Keep at least a 6 month menstrual cycle calendar.
Right.
It gives you a knowledge of what's happening in you. So
Mm-hmm.
that is one about what you need to do. Now, that is for menstruating women. Now, for people who are postmenopausal, so that since we are talking about menses,
Right.
let's just conclude on that. For people who are postmenopausal, when we say postmenopausal, it means you have exceeded the age of menses. Menses are stopped. For us to make a diagnosis of menses being stopped, it means you've not consistently, you've not seen your menses for a year. If you've achieved that, it means you are already postmenopausal. You've achieved menopause. There, thereafter, on no account, and I repeat, on no account should you see blood coming out from your private parts. It's a sinister sign. Any woman who have achieved menopause, who subsequently, for whatever reason, see blood coming out from her private part, should, as a matter of urgency, seek medical care.
Right.
Again, I need to sound a word of caution at this point. Bleeding after the age of menopause does not mean there's a cancer or something so serious, but because 1 out of every 10 of such bleeding will be cancer, the remaining 9 is likely to be other things that are not so
Right.
serious. But you cannot say, you by yourself cannot say which is serious and which is not serious. Because of that, any woman who is postmenopausal, who sees abnormal bleeding, any bleeding after the age of menopause, should seek
You
medical
get checked
attention.
out. Mm-hmm.
You don't say, oh, I've achieved menopause and I started menstruating again. Now you just assume it's something normal. Please never take that chance. Seek medical care. Still in line of bleeding, talking about blood from private part and all of that, let's talk about another common, not so common, but something that may be ignored, which can be sinister. That's bleeding after sexual intercourse. Uh, Sexual intercourse should not cause you to bleed. Oh, well, okay, a young lady being disvirgined and all of that, you can see some bleeding. But beyond that, you should not bleed after sexual intercourse. So if you see blood after sexual intercourse, it's something that requires you to do what? See a medical doctor. Again, it may not be cancer, but it may also be cancer. And when we talk about cancer, people have this faulty understanding or faulty impression that cancer is something that affects people of the old
Right.
age, maybe
Right.
because that's what our exposure used to be. But the reality we are living in now is people as young as 35, 25. Actually, there is a model, I think Georgia, I can't remember the country precisely, of the most beautiful women in the world who died from cervical cancer at the age of 26 or 27 just last year. So, irrespective of your age, if you see this unusual bleeding, please
Right.
present to us. Yeah. We don't even want to get to this stage. I'm going to come to how we will not even get to this stage. But should this have happened, please, you need to present to hospital. Now, let's talk about another important thing as regards our women.
Right.
Uh,
Can I ask some questions real quick,
okay,
if
please
that's
go
okay?
ahead.
Um,
Please go ahead.
um, I had a question about the menstruation one.
Okay.
Um, so okay, this might be, again, I know this, but I'm just asking, just sort of, again, like I said, a lot of things I've been hearing, sometimes I'm like, you don't really know that. So again, I know I don't judge people, but I like to bring awareness, no matter how small the question is. Something as little as, when we see our period from, do you count, so when they ask when was the last cycle, or how people's cycles are 27 to 32 days, know that cycle, right? Do you count from the first day of we see blood pop out, or do you count from the last day when it's dry, when you're dry?
Yes, that's very important, and it's good. There are lots of misconception about that. So when we ask you when was your last menses, we are asking for the first day you see blood pop out. So we usually say the first day of the last menstrual period. That's what we are asking for. And this is also important when we talk about pregnancy, because we did pregnancy using the last menstrual period. That's how
Yeah.
we did pregnancy. A lot of women will assume that it is when they did not see menses that doctor is asking for. No, It is the last message you saw that we're asking for. And when we're asking for the date, it is the first day you saw that message. So it's important you keep a record of your message, and it's important to have this basic understanding of menstrual cycle.
Mm-hmm. Okay. Another question, follow up from that one. So, why? What, what is the juju in when you see when your period comes and you see it day one, day two, day three? Day three is like, oh, I'm drying. Next thing, day five, there's blood again. What does that mean? Some people say it's normal, but what is that?
Yes, this process, the process of bleeding is something under hormonal control. It's the
Okay.
of hormones on the inner lining of the womb that results in the bleeding. There is a certain hormone that is present initially in the woman, which whose quantity reduce significantly, and that's why the woman starts bleeding. And gradually, the hormone starts building up. The hormone starts increasing in quantity again, and that's why you may see some changes in the quantity of blood flow as
Right.
the menstrual flow starts reducing. So it's normal.
Okay.
Once in the regular pattern, it's normal. It's nothing to get bothered about.
Okay. So sometimes it's like you're already towards like the you know
Feeling dry.
dirty red, like dry, like spotting. Next thing is red or pink again, and you're like, wait, I thought I was towards the end of my period. What's going on? Okay. All right.
Yeah.
Another question before I let you
Let me chip
continue,
in
if you don't
something
mind.
at this point before the next question. Can you hear me?
Yes.
Okay, let me chip in something quickly. Now, this what you describe is, oh, okay, first 5 days, I've seen the message for 3 days, it's flowing, it goes down, then increase a little, then stop, save date 5.
Mm-hmm.
That's a normal cycle. But what is not normal is I see the message day 1, it lasted to day 5, I'm dry day 5 to day 10, then I see blood day 11, 12, it stops, then to the next message. This one we refer to it as being intermenstrual bleeding.
Mm.
This is also an abnormal form of bleeding. If that is happening, there are things that can result into that, and such a woman should seek medical
Mental
attention.
attention. Okay.
So,
Okay.
if it's a continuous thing, first 5 days, first 6 days, it's fine. But if it's an interval between this message and the next one, then that requires medical attention.
Right. Okay. Okay. And I have one more before you continue, if you don't mind. So,
All right.
explain the postmenopausal, if you see any kind of blood after a particular age and, when you're at that stage, it's cause for alarm, quote unquote. But what about people that have had children, like at 50, and they are not, kind of those miracles that they say happen? Please explain it if you can.
Okay. Yeah. Let me clarify something. The age of menopause varies depending on the location, the woman. The average age differs from location to location. On the average, we say the average age of menopause is age 51.
Okay.
But in some developed country, you can even get to 50 something, later 55 before menopause. And in our part of the world, as early as 45, some women are already attaining the age of menopause. So it varies.
Okay.
That's a general statement. No. Okay. But a woman who has achieved menopause, I mean, you've had that 1 year period of um,
Yeah.
cessation of menses,
Hmm.
then that means your reproductive career in quote has come to an
Right up.
off. But again, with advancement in medicine, with better understanding of the reproductive system, doctors, gynecologists, and obstetricians have gained the knowledge to reverse this process for
Right.
people who are desirous of pregnancy. So it is not uncommon, it's not unusual. It is miracle of God giving doctors the knowledge to do this, for also reverse the process of menopause for the purpose of achieving pregnancy. It will require us giving certain hormones to stimulate the body and probably need some extra effort, including egg donation and all of that to enable the woman to get pregnant. So it's a possibility that a woman who has achieved menopause can still get pregnant following hormonal manipulation.
Okay. Wow.
What
Okay.
it's not like they have a natural menses thereafter.
Okay. All right. Please go ahead, doctor.
Okay, yeah. Okay. So that's about bleeding and menopause and the menses.
Mm-hmm.
So another important thing is that the female folk, God has designed them to bring forth our progeny. All subsequent generations, all our generations, all the different generations we have in this world, is because God has specially modeled women to play that role to conceive and deliver. So the
Right.
process of pregnancy itself is something that is unique to women and is something that requires special attention. So, as a pregnant woman, first of all, ensure that as a lady, ensure that pregnancy you are going to have is going to be desired and planned. That is the best way of having pregnancy. You should plan your pregnancy. Pregnancy should not be something that occur unwanted, undesired, and there are means of planning pregnancy. So that takes us to use of contraceptive to prevent pregnancy. A lot of myths are around contraception, but again, contraceptives are safe, especially when it's prescribed to you by trained specialists who understand the safety profile of all of these drugs. There is always contraceptive that fits the particular need of a lady. Just ensure that you seek medical attention when you are trying to get contraceptive.
Right.
It's like a cafeteria. It's like a cafeteria. When you go to a cafeteria, you have rice, beans, spaghetti, all you have. You can always get the one that suits your taste. So that's
Mm-hmm.
about contraception. Now, when you now get pregnant, pregnancy it's a journey. It can be a very eventful journey, either of joy or a
That's
turbulent one.
right.
Our wish is always that pregnancy is a joyful one.
Mm-hmm.
And the way to ensure that pregnancy is a joyful one is to have proper antenatal care and ensure that all that is recommended to you, you do it during the pregnancy. And many women pass through the journey of pregnancy having safe delivery and having a happy mother and a happy baby and a happy family, so to say.
Right.
So let's ensure that all our pregnant women should do all that is recommended to them. I'm not going to be going into details of what is required of you in pregnancy, but the most important message I'm passing is that if you are pregnant, ensure that you register, we call it booking. Ensure that you book early in pregnancy and you do all that your health professionals have recommended of you to do.
I agree. I
You're going to
agree.
have splendid experience in pregnancy.
Right.
Uh, we have a lot of supportive staff that will ensure that pregnancy is a joyful one and a lovely experience. So it is our hope that every pregnant woman will come out with good outcome.
Right.
Uh, our part of the world have a bad record in terms of death during pregnancy and all of that. This narrative can change if you and I and everybody on this call take action. Tell your pregnant women around you, go get medical attention. Don't do self-medication in
Right.
pregnancy. If you require attention, ensure you get attention. So that's touching on pregnancy. Now, let's quickly talk about lifestyle, diet, and all of that. You did something at the start of this call, you're taking water. This is not peculiar to women, but it's very important for
Right.
women. Please take a lot of water. Water is life. So ensure that you are always well hydrated. It's very important for you
Yep.
and for everyone. Hydration is good. Then, in terms of lifestyle, too, you should take vegetable and fruits. Excuse me. The ideal is that you take 2 servings of fruits, 3 servings of vegetable in a day. But we understand our locality. Even though we have a lot of fruits and vegetables in our locality, uh, there are other factors that prevent us from getting to eat them.
Right.
We have a lot of fertile land where we get vegetable, but even those who don't have it as much as we do, take it more than we do. But at least ensure that I take fruits and vegetable in a
Right.
day. Not necessarily 5 servings, which is the recommended, but ensure that uh, once in a day you
Mm-hmm.
have fruits and
Mm-hmm.
vegetable in your diet. That's very good. Then ensure that I take balanced diet. Another important thing that you should start setting the agenda that, oh, this year I will ensure that, like I mentioned, 5 servings of vegetable and fruits. You should start,
Mm-hmm.
okay, I want to start with one, then I want to improve it before the end of the year. So the other thing you need to do is working out, doing exercise. The recommendation is that you should have at least 30 minutes of exercise 5 days in a week. Put together, we talk about 150 minutes of exercise in a week.
Yeah.
It's not something so easy if you're not dedicated to it, but you need to
Make
plan
it
for it. Tell yourself,
make it
oh,
a
this
lifestyle.
exactly, exactly. So tell yourself this year, I want to start 10 minutes a day. I want to walk around my compound. I want to walk around my estate. I want to walk from here to there, 10 minutes, increase it to 20 minutes, increase it to 30 minutes in a day. Then you can ultimately you can have more than 30 minutes in a day, or at least have 150 minutes in a week.
Right.
And this can be accommodated within your work schedule. If morning is difficult for you to do, you can do it late in the evening when you get home. The time you are using to watch Netflix, sitting down, lying down on the couch, you can use it to walk around the compound or do any form of exercise.
Right.
Again,
Right.
there's this misconception about exercise. People think, oh, the type of work I do, I move from stairs, I
Yep.
do this, I do that. So I'm exercising. That's not exercise. You need to be dedicated to exercise when you're
Yeah.
talking about exercise. You plan it.
Yes.
The fact that you cook a lot at work, you are stressed, you do a lot of stressful things, does not mean that you are doing exercise. That's a different kettle of game. That's a different thing. That you are busy is different from doing exercise. So please, we should not mix it up. Have a dedicated time when you do exercise and have a plan for it. It's a great thing to do. There are a lot of benefits
Yeah.
that come from doing regular exercise. And
Right.
once you start doing it, it becomes a part of you. You're happy doing it. You see the difference in you. So please, exercise and diet is an important thing.
Yes.
Another important thing, which of course I have to talk about because of my interest, is cancer
Mm.
prevention. The most common cancer globally, I mean, male and female, everybody, the most common cancer in the world globally is breast cancer. And
Mm.
you and I know that breast belongs to women. Yeah, we understand that male also have breast, and
Right.
actually about 1% of breast cancer occurs in male. But when we're talking about 100, I would say 1% occurs in male. Then it means that the people that we need to focus and talk about more about breast cancer is
Female.
female. Now, as a lady, as a woman, you must know your breast. I mean, your breast is a part of a body. You must know all part of it. And when we talk about breast, your breast extends to your axilla, to your armpits. There's a part of the breast that extends to the armpit. So you must know how to examine your breast. And the for breast cancer, when we talk about prevention of breast cancer, what we talk about is early detection. And the only way you can detect breast cancer early is that you know the status of your breast when it's
Right.
normal. You know how your breast feels like when it's normal. So that when an abnormality occur, you can easily pick that this has not always been there.
Right.
A lot of time, women come to the hospital, we examine their breast and say, oh, this thing is there. Have you felt it before? Is it there? start telling you, I'm not sure, is it there, is it not there? It shows that the woman that has not been examining her breast before. It's just like looking at the back of your palm. You know all that is at the back of your palm. If something new comes up there, know that this has never
Right.
been there before. That is how well you should know your breast. And when we talk about the breast, is the breast tissue, the areola, that's the black part around the nipple, and the nipple itself. I'm not going to talk about how you examine your breast. That is not the discussion for the day. But there are videos on YouTube. There are different pictures and all of that for you to learn how to examine your breast. And
Right.
something you can do within few minutes, and it's easy to learn. It's something you can do.
That's
But
true.
there are dancing videos to show you how to do that. So you must know your breast and you must examine your breast.
Yeah.
It's encouraged that you examine your breast in each of every circle of your menses. You must examine that once in a month. You should have a detailed examination of your breast. Use your mirror to do all the examination,
Right.
and that's very important.
Right.
So that's
Yeah.
about breast cancer. You must examine your breast.
I mean,
Another unique cancer that I am more interested in is cervical cancer.
mm-hmm.
Now, the cervix is unlike the breast. The cervix is not something you can easily see by yourself. In fact, you cannot see it on your
Nope.
own. It's only an health provider that can see it. But the thing about prevention of cervical cancer is that you must present to health facility to have screening. Screening means that you do not have a problem. Now, when we talk about screening, we're not talking about somebody that has a complaint that she's bleeding abnormally after sexual intercourse, like I made reference to earlier.
Right.
We're talking about a woman who has no complaint. You feel healthy, everything is fine.
Yep.
So you take your present to the hospital or to healthcare provider, examine this place for me and check if there's any abnormality.
Like a routine check.
Because
Like you said earlier,
yes,
like your vehicle, take it for routine checks, make sure everything is okay. Change the oil, check the oil, pour it out, things like that.
exactly. You should have a cervical examination as a young woman, as a woman in general, up to the age of
Mm.
65. At least on the average, depending on the type of test you are doing, there are different type of tests, which I'm sure one of these days we are going to go into detail of cervical cancer and talk about it in detail. By the way, this month is a month of cervical cancer awareness, and globally everybody is talking about cervical cancer. January
Okay.
is a month for cervical cancer. So you should pick a date. Some will pick their birthday to say, oh, on my birthday or 2 days after my birthday, I will ensure that I will check,
Yes.
do this test, do that test,
Mm.
and allow you to do it regularly.
Right.
So depending on the type of test you do, you can do it every 3 months, every 3 years, or every 5 years to check your cervix and ensure that everything is fine.
Right. Right.
The good thing about cervical cancer is that when you do this screening that we talk about, if there are abnormalities and it's big, you can be treated and it prevents you from even having a cancer at all in the first place. Unlike for breast cancer, where you want to detect the cancer early
Mm.
before it becomes so serious. For cervical cancer, if you are able to pick this through the screening, you're able to detect the presence of these
Yeah.
pre-malignant, pre-cancer. You're able to detect it and they're able to treat you and you prevent you from having cancer. So please, for all of us on this call, be it male or female, ensure that you inform your loved ones about the fact that they need to get screened.
Right.
Of course, in relation to that, we should ensure that our young girls are vaccinated. So if you have
Mm.
young female, well, it's not just limited to female, but at least the most important is that we have a young female girl, 9 to 14, should get vaccinated to prevent them from having this cancer we talk about.
Right.
Another one that is not often talked about, which I think I should make mention of, is that beyond cancer of the cervix, cancer of the breast, which are the common ones, cancer of the endometrium, that's of the womb itself, which can
Right.
present with bleeding. There are other things, there are other cancers that can, or abnormality that can occur, not necessarily cancer now, from your private part. So it is the responsibility of a lady, of a woman that is um, interested in her health to ensure that you know the normal anatomy, the normal way your private part looks like. Yes, you cannot see it by yourself, but you can use a mirror. And that's why I say a
Hold on, hold
mirror
on.
is an important part. It's not just for you to look at your face. It's not the mirror is not just for you to look at your face. You use it to look at to examine your breast. You use it to examine your private part. Now, the reason for this is that the cancers that develop from the vulva, that's the female private part, often start with a small lump which you may never
Oh,
see. Or it may start from a change in coloration of that area which you may never have seen. And if you take it as a point of duty to often, you don't need to do it every month like for breast cancer, but at least every few months ensure that I just check and see that there is no changes that is occurring there. And you have a little lump or something present to the
right.
hospital. It's not a very common malignancy, but it's something that if you are checking, especially for the older age group, if you check and you detect it early, treatment and cure can be achieved when it's big.
So,
Yeah.
sorry,
So since we are still
sorry to cut you.
okay,
That part of using the mirror
okay, go
got
ahead.
me. So I will take my mirror and I will put it down there and I will see something. Please explain that part again because I don't understand.
Yeah. Yes, it sounds a little funny, yeah, but it's very important.
Okay.
For the part of the body that you can easily see, you can look at it and see, oh, there is no change, there is no abnormality. Now, for you as a lady, like I mentioned, the cancer of the vulva or vaginal vulva
Right.
is not a very common, it's a rare thing. And it's not something that usually occur in the younger age group. It usually occur in the older age group.
Right.
But as part of being careful, as part of knowing your body, it is recommended that if it's once in 6 months, once in 3 months, take a look at that area. Ensure that nothing different is appearing there. There is no change in coloration. There is no growth that is coming that you've never
Hmm.
noticed in the past. Just take a look. Ensure that it's the way it has always been. Like just for you to just inspect that part of your body.
Right.
And if you see anything unusual, seek medical
Hmm.
attention. Now,
Okay.
since we are talking about the private part, there is an habit. There's an habit a lot of lady practice, which we need to also talk about. We call it dodging.
Aha.
A lot
I,
of
I actually had a note to ask you about that. Thank you. Continue. That's important to me too because I don't understand why they do that.
a lot of women have this impression that their private parts, if they don't wash it with soap, it will be
Smelly.
it
It's
will
not
be
clean.
clean, it won't be clean, it will be the vagina is a self-cleansing organ. What does that mean?
That's right.
God has designed the vagina such that it cleanses itself on its own.
Yeah.
Every woman is supposed to have some level of discharge or secretion is a normal thing
Right.
and it's not something normal. The area is not meant to be dry like paper. If you have some secretion, because there are glands there, there are glands from the cervix that secrete and ensure that everywhere is at least not is lubricated,
Mm.
and so you should have some level of secretion that keeps the place a little wet.
Right.
When we become worried, if this is foul smelling, if there is a change in consistency, and this is still about knowing your normal self. When you know the normal consistency of your dish and how it looks like, when abnormality sets in, you are going to know. Now, there are bacteria, and I repeat, there are bacteria in the vagina. It's a normal thing. We
Right.
call it normal flora.
Yeah.
These bacteria that are present in your vagina, they prevent the growth of other organisms that can be harmful.
Right.
So when you wash, when you put soap washing, you're going to wash away these normal natural bacteria that are meant to be in the vagina.
That's right.
And what you're probably going to have is that there will be overgrowth of the abnormal ones. Therefore, you
Yeah.
start having discharge. And when the cycle starts, it's very difficult to stop it. When you start doubting
Mhm.
and you start having vaginal discharge, you just continue the cycle. You have discharge, you treat. You have discharge, you treat. It's a difficult one to do. So you advise women to stop dodging. Don't dodge. The body is a natural cleansing.
Right.
The vagina has a natural cleansing mechanism. Yes, there are some, you know, tubes and all of that are marketed for the
Yeah.
purpose of cleansing the vagina. Personally, well, you may say that I don't have a vagina, so I shouldn't say personally, but from my experience and from what I know, from my knowledge, all of these things are just money making. Uh,
Yeah, I agree.
what's it
I
called?
agree.
Money
No, I agree.
products.
Mm-hmm.
They are money making products. Your body has a natural uh, mechanism
Fragrance,
to ensure that your
perfume,
vagina.
smell. Because the way, like you said, like sorry to cut you, but like you said, I totally believe. Because I had a note to ask you to talk about that, but you just went right into it. Because our body, something that you say, and I like to echo a lot, is just if you know your body, you will know when there are changes. You will know that that smell was not like that yesterday. What happened? What did I do? Like there's a way our body smells before our menstrual cycle, during, after, like there's a way our body. So if you're used to that, if you know that when it starts to go to that yeleja smell, like the fishy one, you begin to like, what happened? What happened? And you let your body like again. I think the thing is kind of like we are with God. We like to want to help God do his job, but we should just let him do his thing. That's how a vagina is. Like we just let the body just fix itself sometimes. And if it causes
Yeah,
for alarm after a period of time, then consult your doctor. Don't go
exactly.
and buy an OTC to help your body wash it. Do you understand? So I totally agree with that. All these things, I don't want to call any brand's name, but all these things you see, it's just to make money. And people are like, oh, I want to smell like fragrance and lavender. No, you don't have to smell like that. So I'll let you
Exactly.
continue. I'm just going to throw in a question. I can continue because I
Okay.
have a thing with taking baths. When we soak ourselves in the bath, should we as women do that, and how often should we or not do it? Is it safe? Why I'm asking that, how when we get in the bath, water, obviously, or even the pool, get into that place.
Yeah,
Please explain.
absolutely.
Thank you.
Absolutely. Yeah, it's something of concern. It's a question that is often asked. The thing about birth is that when you do not actively, when I mean actively, you intentionally dip soap into your
Mm,
private part. There's limited quantity of water or soap water that is going to go in if you just
got it.
take a deep bed. But the problem is when you intentionally, I mean, when you attempt to put sponge in there to wash it out, that's when it's worrisome. But the little water or soap water that is getting there from a deep bed in a bath tube is not going to cause a lot of concern. So
Got it.
you can take a bath as a woman, it's not an issue, but do not attempt to go in to go wash with soapy water. That
Right.
is what we discourage.
Got it.
Okay.
So I'm just going to add also to that. Now, one thing I've been doing is because I know when our period comes and all of that, um, not douching like you say, but like maybe wipe down the lip of our vagina.
Yes, that's.
So
Sorry, let me just make a comment on that. It's very important because when we now say women should not doubt, they don't get it right, and it's important to differentiate between douching and cleaning your vulva. Now, um, for us, I mean, for the lay persons, when we talk about vagina and vulva, everything is the same thing. But
mm,
in medical parlance, there are two different things. The vulva is that lip you see outside,
yeah,
and some other parts, that lip that is outside. I'm referring to that you should check with your mirror. But the vagina is that part that is deep in.
right.
So you should always clean your vulva. That is, use a lukewarm water to clean your vulva.
Mm,
That's expected. That's normal. It's not
right.
what we talk about when we talk about douching. But douching is going in to use soap to clean from inside out. That's what it's called. So it's encouraged that you clean your vulva. That is not a you use a gentle soap and water to clean your vulva. That's okay. That's not an issue.
Okay. Okay. Thank you. Um, I have some questions I'd like to ask. These are very basic questions. I'm asking this again. These are because of some talks I've gotten into, and it makes me just want to like You didn't know that? You know, things like that. So that's why I'm asking. I'm asking it for everybody because, again, you know me, it's about bringing awareness to people, the things that we can do by ourselves. Um, I'm just going to try and read it out. Please talk about the basic hygiene a lady should know. That's one. Two, please explain the proper way to wipe down after a female goes to use the bathroom. You know, after we pee. What's the way? Is it front to back or back to front? Mm? And when to start caring for ourselves as a woman. Because people, you know, you hear things like, oh, she's too young for that, or you should know that. So, what age? Is it like when they're born? Is it when they're like, is it their first period? Please touch on those. Thank you.
Yeah, you've asked some very germane and important question, which our viewers and listeners need answers to, and I'm sure they will pass the answers across to other people around them. Yeah. Now, I'll start from the last one, which is what age should a lady start getting to care about her health? It's across the life cycle. There's no particular age when you should start. At different points in life, there are particular things that are required of a lady that needs attention.
Right.
One of which is that's attempting to answer your second question now is to learn how to wipe. Now, just like adults can have vaginal discharge, children, toddlers can also have vaginal discharge, and oftentimes when a toddler have vaginal discharge, it's not because of an infection, so to say. I mean, of course, not sexually transmitted infection
Right.
in this case. That is an infection because of poor hygiene. So, as early in life as possible, a lady should be taught hygiene of a private part.
Right.
And one of the important things to do in terms of hygiene is to learn how to wipe. Because of the closeness, or we say proximity, of the anus and the female private part, they are so close together. Bacteria and infectious organisms from the anus can move into the private part if you do not know how to clean.
Right.
So cleaning should be from front to back. You don't do back to front. When you do back to front, you are taking what is behind to
Bring
the
it
private part.
forward.
So, and this knowledge, this knowledge is meant to have been learned as early as possible in life. So, as you are teaching a young girl on how to do other things in as part of the training, doing potty training and all of that, you must train the young girl on how to clean. So, an important thing that needs to be learned
Right.
as early as possible in life. That's on the extreme at the younger age. And there are different things to learn at different points in life and to do in different points. At later time in life, at say postmenopausal woman in older age group, a old woman should learn how to maintain her bone health. Now, there's one unique thing about women, which I think I should just chip in at this point, is that the lady produces an hormone we call estrogen. I'm sure many of our listeners will know about estrogen that protects the bone of a lady and makes the woman healthy in terms of bone health.
Mm.
But immediately she achieves menopause, the estrogen level drops significantly. And because of this drop in estrogen level, that positive effect of estrogen on the bone is lost. And that is why it's common amongst women to see women with fractures at older age group. Some women become shorter than they used to be. It's some of these subtle fractures that cause this drop in height.
Wow.
They are more at risk of having long bone fracture and all of that. So at older age group, a woman should know that her bone health should be maintained.
Mm.
And that's why eating vegetables, taking a lot of calcium is important and maintained during the menopause so that all of these issues do not come into play. So at the care of a lady is across life cycle. At every point in life, there are certain things you need to do. Cancer screening, for example, depends on the age. For a woman that's age, every lady should know how to do self breast examination. But as soon as you reach the age of 40 and above, you should be doing mammography to examine your breast and see if there's any abnormality.
Right.
At age of 55, you should start doing cervical cancer screening. So there are differences to do at different age, but there's no point. There's no point in time when you should leave your health unattended to. You
Right.
must actively take care of your health.
Um.
So I think I've talked about cleaning, yes.
Yes.
Then hygiene in general. A lady is special, and one of the selling point of a lady is a general outlook and hygiene. So it is important you have a good hygiene, cleaning all part of the body, from managing your mouth and oral cavity to managing your all the parts of your body. There are conditions and clinical diseases that are associated with hygiene, such as some fungal infection and all of that. Then in terms of menstrual hygiene is also an important thing. You should have good menstrual hygiene, and I think I should make mention of it. There are some particular diseases, toxic TST, that's a condition that is associated with poor menstrual hygiene because of certain bacteria that can overgrow because of poor menstrual hygiene.
Right.
If you are using a tampon, you should know how to use it appropriately. If you are using a pad, you must use it appropriately. Don't use a single pad for the whole day, even when it's soaked, because blood is a culture medium for infection.
Right.
Blood is a culture medium. Blood encourages bacteria to grow. So when you leave your soaked pad unattended to for a long time, or you just cut a rag, uh, maybe not rag precisely, but you pick a wrapper and you just cut and use it as your form of sanitary control.
Right.
A pad that is not well prepared and all of that, can allow you to have some certain infection. It may be difficult to treat. So proper hygiene is very key for everybody, and more importantly for a lady.
Right. Hmm. Thank you. I have a question. Um, but that question might get me in trouble, so I'll ask it in a little bit. But going back to the lifestyle, diet, vegetable we talked about, you did say water is life, which I try to, stick to that. So you said portion of vegetable and fruits. What of people that just drink smoothie or juice? Does that count as vegetables or fruits without measuring it? Just, I don't know, probably a dumb question. That's one. Two, can somebody supplement? Can somebody take supplements to substitute, fruits and veggies?
Yeah, important question you asked. Let me respond to the first one. Smoothie in place of vegetable. It's all about how it's prepared. If it's raw fruits without any additive and anything that you just prepare and you take,
Right.
it's fine. You can take it in any form that makes it convenient for you to
Gotcha.
take it. It's fine. But what will not be encouraged is that you now start adding a lot of additives that now
Right.
makes the nutritive value depreciate that depreciates the nutritive value of what you are taking. And the same thing with vegetable. But what I want to say about vegetable is that for us, the way we eat our vegetable, by the time we've boiled, we've added hot water, we've added a lot of things, boil it for a lot of minutes, the required nutrients from the
Disappear.
vegetable will have been washed away with our water. So when you add hot water to your vegetable to make it tender and soft, by the time you are pouring away the water, you're actually pouring away the single
Ah,
parts of what you should be
doctor.
consuming. So
Doctor.
why not asking you to cook raw vegetable? Yeah.
Doctor, this one,
Why
this
am I
one,
asking?
this one will fight small because there's
Yeah.
something called a hair. They answer in the comments. Something called blanching, where like we that like a for euro. Blanching is.
Yeah.
Let me explain it to you. And I
All right.
did actually I did read, and you didn't say it to take out the nutrient. That's why I do it. So it's make it like a roll, and the veggies might be a little hard. So you boil the water, and then you already vegetable whatever, and then you pour it less than 3 seconds. You pour it out. You just cover it to steam, and then you pour it and just use cold water to rinse it out. Would that one still strip nutrients?
Well, that's putting it. That's. I think that's fine. That's like a compromise. You know, our culture and our taste bud and all of that is not like that of
Right,
the
right,
like white. Yeah. So we are trying to have a balance between the two. But what we will discourage is, you know how we do a roll now.
yeah,
When you put the vegetable inside the hot water for 10,
mm,
20 minutes, you want it to be very soft and all
yeah.
of that. That is what,
Okay,
as much as possible, give me the time you are putting it on that vegetable because you probably be losing some nutrients. Of course, if you are eating vegetable, it has to be something that you'll be able to take. You're able to take it. Not many of us can take raw vegetable. I can't take raw vegetable, uncooked vegetable, but I mean there should be a balance. Blanching, like you rightly described, would be a compromise between not eating the raw vegetable and overcooking it. It's the
right.
overcooked one that's actually the concern. So I'm not saying we should eat raw vegetable. I can't eat raw vegetable too. But
Okay.
what I'm saying, don't overcook it.
Right.
Uh,
Okay. Got it. Because you can see the comment section about to start the protest now that what's the alpha? Because that blanching is the way for the way out.
yeah.
Now let me ask that my question. Hopefully they don't stone me. Please, can you please explain the positive and negative effect of BBL on a woman's body?
All right. I'll attempt to answer this. I may not be authoritative on this. I wish you had
It's
seen me.
okay.
You'll have seen this man
Yes,
you asked.
that's okay.
Yeah. Yes. Now you caught my head.
I'm
Yeah.
sorry.
Let me answer it. Let me answer it this way. Health. When we talk about health of a woman, is not just about physical or social, but about mental well-being of the person.
Yeah.
Now, it's an all-round thing. Is a package, so to say. You need to be healthy across board, mentally, physically, socially. You must be healthy. Um, One of the part of mental health or being healthy mentally is your satisfaction with your body. You need to have satisfaction with your body
Right.
and getting uh, getting the shape that makes you satisfied with your body may be a means of you getting that satisfaction, that mental health satisfaction.
Right.
Now, if you must do it, I mean, if you must engage in BBL, you must do it. You must ensure that it's a professional that is doing it for you. And then I
Okay.
mean professional. There are a lot of people doing it out there. But we ensure that it's someone who knows his onion, who knows what he's doing, that is doing it for you, and is doing it using the appropriate tools for what you are requiring of the person.
Mm.
Because I started by saying that mental health is important. People may do it because of their mental health. But again, if it's not well done, if it's not done the way it should be done, it can actually be the reverse. It can actually affect the mental health of the person whom it is done
Right.
when it is not well done, or when it becomes complicated, or it can actually affect the physical health of the person. We
Mm-hmm.
had a lot of stories of people doing BBL and dying from the process. So, and again, you should not do BBL just because you want to join
Right.
the what is in vogue.
Yeah.
You must ask yourself, why am I doing this? Am I doing this just because Chika has done it, this person has done it, this person has done it? I should join the trail of people that have done it. That
Right.
should not be the reason why I do it. You should ask yourself if this is really what I want. what benefit is this accruing to me? The most important benefit of doing BBL is having a satisfaction with your
Yeah.
body. I mean, body shape. And a lot of us look beautiful the way we are made. Yes, we know of people who have uh, issues with their body shape that is obvious to everyone. But
Right.
some of the people that do it is not because there is a distortion in their body, but just because they just want to catch cruise and be among what the society is doing. So whoever is doing it must do it with the clear understanding of the fact that it has its own risk.
Yeah.
Fat embolism can occur. A lot of complications can occur, just like any other procedure anyway.
Mm.
A lot of complications can occur from it. So when you are doing it, be sure in your mind that it's something you really want. It's
Right.
something that, God forbid, if it goes wrong, I know that what I was doing it for initially is something that I'm happy with, and it may be a
Okay.
complication of it. You don't go do something because, say,
Oh,
Lawal is doing it, I want to do it, I now have a complication.
right.
You start asking yourself questions, you start having regret, and a lot of things can, suicidal ideation can come
Okay.
in and all of that. So,
So,
something, you
sorry, go
said,
ahead. Yeah, I was going to say something, but go ahead, please.
okay. So BBL, I won't be emphatic to say it is bad, it is good, or it's a personal conviction, but you need to be clear in your mind. Why am I doing it?
Okay.
And you need to be clear in your mind that this is a procedure that has its own risk. And if this risk and complication sets in, will I be happy with myself? And when you are doing it, because you know that it's a condition that has a risk, ensure that you are doing it in persons who have been tested and trusted to carry out the procedure. I hope I've answered the
You
question with the best.
you have, honestly, and I'm going to echo the part that you said something in the lines of BBL is just like every other surgery. It's it can be dangerous too. But the reason why I actually asked the question is not even totally understand the mental part of it. Like going to do something, it's maybe get my hair done. Oh, maybe my hair being nappy. I just want to feel confident, that's why I go get my hair done. Something as little as that, right? But what I actually asked about BBL is for the woman body. How does it affect us? Like, but I like when you added the part that you have to go to a professional, not just, oh, I have someone that can do it cheaper. You understand? It's not that kind of bargain. So that's why I asked,
Yes,
because sometimes we don't
on
we
that.
don't sometimes we don't even we don't consider the consequences that this might have on us, but we just go and do it because, oh, this person did it and they did it well, I'm going to go there. Because I've heard about, for example, people who go and have like weight loss surgery. Your doctor has to clear you to go get that surgery. You don't just show up and get the surgery. What if you're not cleared? So that's why I wanted to touch on that so that we can know that it's a good thing. It can also be a bad thing. Let's not just follow the crowd.
Exactly. Exactly.
Okay. Excuse me. So doctor, I just saw the time is over an hour. So is there anything else you like to add? I know that 1 hour is always like too small for us, but is there anything else you like to add to teachers? We got to take home today,
Yeah, I think we've covered almost the whole part of the body and
Yeah.
things that need to be said. Um, what I may just want to add to what I've said is this. I focused on things you need to do as a lady, but remember that there are things that cut across everyone, and
Yeah.
we should also give attention to that.
Hmm.
That will include checking your blood sugar, checking your blood pressure,
Yeah.
checking your kidney function, uh, having routine medical check as it may,
Right.
and having your having routine medical check. Let me just put it that way.
Yeah.
It's very important. We should encourage ourselves to get all of these things done.
Yep.
A lot of time, when we talk about taking care of ourselves, like I'll tell myself, oh, I want to ensure that I take care of myself. I mean, as a lady, what people are referring to is, I want to have this beautiful hairdo. I want to have this great, nice clothing on me this year.
I
This
want to
year
go on
is
vacation.
about exactly. That's what we refer to. But when we talk about taking care of ourselves, we should start looking at the intrinsic self. I mean, the body that's carrying all
Yeah.
of these things. So it's not just about your skin. Your skin is important. In fact, the skin is the biggest, largest organ in the body. Just like liver is another large organ. So
Right.
the skin is very large and very important that you take care of it.
Right.
And skincare is not something mundane. It's very important too. But don't just focus on taking care of your skin, lightening of skin. Okay, sorry. I think I should mention this too.
Please mention.
It's very important.
Please mention.
Yes, like skin lightening is something in vogue, and it's in a lot of
Right.
us do. Uh, just like BBL and any of the things that are in vogue, usually we do it in order to catch a, join the crowd, so to say. But it has its effects.
Right.
The dermatologist will tell you a lot of things about what effect skin lightening does to the body.
Mm-hmm.
It's not just about what you're seeing outside. Now you used to be black, now you're fair in complexion. It's not just about that. A lot of damages. There are protective layer on our skin that prevent ultraviolet rays that can cause cancer from penetrating our body. By the time you bleach, you lose melanin.
Mm-hmm.
Those that protective effect is lost. That's
Right.
one. Two, there are contents of these bleaching drugs and cream and all of that that are harmful not just to the skin but to the kidney.
Right.
We have hydroquinone, we have mercury and all of that that can shut down the kidney. The unfortunate part of this is this. The unfortunate part of it is this. The effect of these drugs, you will not feel it, you will not see it in 3 months,
Yep.
6 months, 1 year, two
Mm-hmm.
years, 5 years. You may be feeling the effect 20 years after you've been
It's
using
a
the product.
futuristic something.
Yes, so please, it's well, maybe my gender have started copying the practice now.
Doctor
It used to
says
be
gender.
that
God,
of
I
the
beg.
he said what?
You say your gender started.
So it's common amongst us the ladies, and that's why I think it's something I need to mention.
Right.
So by and
Right.
large, those are things. It's something talking about agenda for women. It's personal health is a lot of discussion that an hour is definitely not enough to
Right.
cover. But I
Right.
think you've done an overview of different things
Yes.
that we need to mention of. We can in future go into
Yep.
details of some of these
And
things and discuss.
this is what a way to start the year, to start Chapter Chica for 2024 with Dr. Lawal Kudus coming to tell us how to take care of our body. There couldn't have been a better guest for this, but thank you so much, Doctor. We've gone over 1 hour, like 1 hour. No, they even do it again because I know I love how you just try to bullet point this agenda for us, but we're going to come back and talk about them, and deal with them because again, we have to bring awareness to these things, to be honest, so we can all learn. Because today I have learned that I can use mirror and look down there and see what's going on. I didn't know that I can. I can learn. I can do that. That's one thing I didn't know I could do. So thank you so much or for always willing to be a guest and for opening the show for us this year. Thank you guys for joining. And obviously, I am going to post this. Go back and watch it. Go and watch it. I love today. The network was doing anyhow before, Stony on your own because he was doing anyhow. We can't see each other, but I can hear his voice.
Yeah.
And
Yeah.
thank you for people that joined, that watched it, that made me laugh and say things. And thank you so much, Dr. Kudus, for teaching us, as always. I would try and post it, and I would try. See, I always make notes, now. Like I say, this might be an IG live, but is also for me to learn. I'm learning, honestly, and I thank you for coming to watch and watching this after. And yeah, that's it. I will leave it on my page. Don't worry, all of you that came late, don't worry about it. But yeah, Dr. Kudus, any final words for us?
Yes, it's my primary area of concern is cancer and precisely cervical cancer, and
Yeah,
it's cervical cancer awareness month. So I'm calling on all of us on this call. For cervical cancer, it's a cancer that we have all the tools, and I repeat, all the tools that are required to prevent it. And
right.
therefore, every single death from this cancer is something that touches the heart. It's something that cause for worry because it's something that can be prevented.
Mm-hmm.
And it's not just something that is abstract. Some certain countries in the world, including African countries, are already taking each step to prevent this cancer. So we shouldn't carry last, so to say. So we should not grieve
No
for cervical cancer this
grief for
year.
no grief for
And a
no
way of
grief
not
for
grieving for
cervical cancer.
So a way
Yeah,
of not grieving for cervical cancer is ensure that the government have made HPV vaccination free and available in the country. Ensure that your young girls get vaccinated. Screening is available in many institutions in the country. Ensure that you have screening done for cervical cancer. And when something is detected, if you have abnormal bleeding on any of those issues, ensure that you present to the hospital early.
okay,
This message should not rest with you. You should ensure that you pass the message on to all your loved ones,
that's
and
right.
if possible, people you don't love to get to know about this message that we passed today. And by doing that, you have contributed to making the world a better place. Thank
Man,
you.
thank you. Someone just said government in Nigeria.
Yes,
Yes.
happily. So, the government of Nigeria, through the National Health, Primary Health Care Development Agency, uh, faced HPV vaccination in late last year. 16 states last year, and the other states of the country are expected to join in this first quarter of the year.
Wow.
So, go to primary health center. The thing about HPV vaccine is that on the market, the cost of a single dose is about say 30,000 thereabout. As at before dollar is dollar is on a roll of its own now.
Right.
As at then it's about 30,000 thereabout. And the type that's being given is actually about 85,000 as at that time. I'm sure it's far above that, and it's being provided free of charge at the moment. So please let's grab this opportunity. Let's ensure that
Yes.
everybody that's eligible gets the vaccination.
Thank you.
Thank you.
Thank you so much. I love you all. Thank you for listening and asking questions and for watching this. And again, I cannot say this enough. Thank you, Dr. Lawal, for your willingness. God bless you. And I will see you guys next month. This year, we're doing one show per month. I beg you, no vex. Yeah. So see you guys next month. I will let you know the details. I love you all. Mwah. Bye.